Science has a really important role to play in the development of understanding how the mum passes on her bugs to her baby. A lot of information is out around vaginal seeding. It's one of the most common questions that I get asked. I guess what the important thing is to understand is that we're evolving into a space which, despite all of our interventions or necessary interventions for obstetric practice, caesarean sections, antibiotics for group B strep prophylaxis and things like that, that we can do some things to help change or modify the baby's microbiome by passing on what the mum naturally has. One option is vaginal seeding. We place a gauze in the vagina of the woman and then basically rub the vaginal fluid over the baby's face, eyes, mouth, back and whole body, replicating a vaginal birth for that child. The research is suggesting that that does have an impact, and our local policies and procedures haven't come to grips with that at the moment because it's a risk versus benefit kind of weighing up of the options of whether we should be doing that routinely. So vaginal seeding is requested amongst some of the patients that I look after, particularly in the public and the private sector in Australia. And the important thing there is information sharing in an accurate way, to say there is some evidence to say that it does make a difference and has an impact, but at the moment we haven't had the consensus statement to say that we would endorse that for everybody. And again, it's difficult because then mothers feel guilty one way or the other. Am I now going against medical advice because I want to do vaginal seeding? So I help empower women to make the decision, and then the decision is theirs. The development of science and where it's leading to might in fact lead to a future where we do a stool sample or a poo sample pre-conception or in early pregnancy to be able to then determine whether these women are at risk of developing things like gestational diabetes or preeclampsia. Recent research has showed that there are associations between those pregnancy outcomes, and if there's something we can then identify, complement, eliminate or add to the woman's microbiome pre-conception, we might be able to change the clinical course of her projected pregnancy in that way.